The pharmaceutical industry has to switch in terms of the organization and implementation of clinical studies, because at the turn of the year, service providers in Great Britain are considered nationals of third countries. If the EU and the United Kingdom are still struggling to further develop their relations after the UK has already left the EU and the end of the transition period at the end of this year, a drastic paradigm shift in clinical trials is already emerging at the turn of the year. Because the QPs, the qualified persons for the release of clinical material, that's investigational medical products or IMPs, must be located in the EU from January 1st, 2021. This emerges from a joint technical note from the EU Commission, the EU Approval Authority EMA, and the heads of medicines agencies HMA, the Association of the National Approval Authorities for Human and Veterinary Medical Products in the European Economic Area. The reason was that Great Britain had not applied for the necessary status extension and would therefore be treated as a third country from New Year's Day 2021. As the Hamburg-based service provider for pharmaceutical and biotechnology companies, GBA Group Pharma makes clear, this new regulation affects not only future but also numerous ongoing clinical studies. Pharmaceutical companies may face considerable difficulties from January 1st, 2021 if they do their clinical studies in the EU with QP partners from Great Britain. Due to the complex supply chains for clinical trials in the EU, companies would have to take immediate measures to ensure that their clinical projects are carried out. In the view of the GBA Group, after the Brexit, the QPs, which played a central role in the development, manufacture and logistics of pharmaceuticals in Europe, will no longer be authorized to certify clinical materials for the European Union if they are based in Great Britain. As a result, pharmaceutical companies that work with QPs in the UK may face supply chain disruptions if they exit the EU like this. This applies both to IMPs and investigational new drugs, INDs, and to products that have already been approved. New regulations, in particular for the supply of clinical trials with clinical trial supplies, the so-called CTSMs, and for QP services, can lead to additional costs in the millions for pharmaceutical companies for possible delays or discontinuations of clinical trials if they are not prepared in time, says a company announcement by the Hamburg company. In addition, the logistics for approved products will become significantly more complicated as part of the Brexit. The joint technical note from the EU Commission, EMA and HMA states, trial products used in clinical studies can only be imported if their batch release has been certified by a qualified person in the EU. Otherwise, in the worst case scenario, study treatment can be interrupted and the safety of the study participants endangered. As noted in the note, as of July 1st, 2020, 250 studies were registered in the European Clinical Trials Database, in which QPs are located in the United Kingdom and in at least one member state or than in the past 3 years approved in the United Kingdom. Due to the new legal situation, Elizabeth Lechner, CEO of GBA Group Pharma, must now act quickly if they use UK-based QPs and other CTSM service providers. Specifically, the challenge was to establish QPs in the European Union by the end of the year that mastered the respective national language and regulation. This could result in a shortage of suitable QPs in the EU. Current clinical studies cannot simply be cancelled. Any disruption can mean that existing qualified and audited supply chains have to be reorganized for ongoing and planned studies. Lechner explains the tricky situation. If a company has to change the QP in the course of a study, a new QP may have to requalify the entire supply chain, adds Lechner. In addition to the massive effects of the corona crisis, there is another critical challenge for the pharmaceutical industry. Lechner urges quick action. Meanwhile, clinical trials are not the only major construction site for the pharmaceutical industry in the Brexit universe. Only recently, the European Umbrella Organization for the Research-Based Pharmaceutical Industry, the EFIPIA, warned that the pharmaceutical exports in the EU as well as in the UK would have to give up a lot if there were to be a no-deal scenario and thus a hard Brexit without an agreement. The GBA Group sees an additional potential burden for the pharmaceutical industry there. Transporting medicines within the Union is a problem for companies outside the EU. Today, these products can be transported and distributed without import or export duties. With the completion of Brexit, UK-made medicines could be subject to VAT if they are shipped to the EU, Lechner says. And if you want to know more about European politics from a German point of view now, YouTube has chosen another of my videos right here in the end screen, right next to your chance to subscribe to my channel. I'll see you in my next video. Click and enjoy. Viel Spaß!